Everyone, thank you for attending my presentation today. My name is Mira Yus, and I'm a PhD in nursing student at McMaster University. Today I'll be talking about the first part of my mixed method study. The presentation is entitled Adapting the Namaste Care Program with Caregivers of Community-Dwelling Older Adults with Mid to Late Stage Dementia. I'd like to acknowledge and thank my funders, the Alzheimer's Society Foundation and the Canadian Gerontological Nursing Association. I'd also like to present my team of incredible mentors, my supervisor, Dr. Jenny Plow, and my co-supervisors, Dr. Sharon Kasalainen and Dr. Carrie McCaney. So in Canada, over 260,000 people are living with dementia at home, and they're choosing to live at home due to the rising costs of long-term care. Family and friend caregivers are very highly involved in supporting people living with dementia at home. And especially when the dementia progresses towards the more advanced forms, advanced stages, that they do really take on more and more responsibilities. Most caregivers, unfortunately, receive little education and support in being a caregiver, and this therefore leads to poor outcomes for this population. So what can we do to support caregivers? We could provide them with psychosocial programs that aims at targeting their skills, their competency, and their knowledge in being a caregiver. These kinds of programs have been found to reduce caregiver burden and depression and increase their confidence in being able to support persons living with dementia with their activities of daily living. And it also improves the physical and mental health of not only caregivers, but persons living with dementia as well. So Namaste Care is a type of psychosocial program. It was originally created by Professor Joyce Simard in the US, and she created this program because she found in long-term care there was a lack of programs for people with advanced dementia who may not be able to take part in bingo or card activities. So what Namaste Care is a personalized, holistic approach that focuses on the person's likes, their histories, and it also can improve the quality of life of persons living with dementia. The program is provided by focusing on the 5 basic human senses and stimulating these senses by combining different activities such as massages, aromatherapy, music, snacks, and beverages. The main principles of this program is a comfortable environment and providing loving touch in a manner that is unhurried. So what are the current gaps in the literature? There are a few psychosocial programs for people with moderate to advanced dementia in the community. Most of the programs focus on people in the earlier stages of dementia. Few programs are created in collaboration with caregivers, and most of the time it's the researcher that actually designs these programs with little input from caregivers. Namaste Care has not been adapted for use by caregivers in the home setting, as it has been predominantly used in long-term care. So in addressing the research gaps, my research question is, how do caregivers envision the adaptation of the Namaste Care program for community-dwelling older adults with mid to late stage dementia? The research design is qualitative description that allows me to remain close to the words of participants by allowing some form of interpretation. The model of the system of classifying modifications to evidence-based programs or interventions has been used to guide the adaptation process, and also it has been used as a coding framework for this study. One of the outputs of the research is a creation of a training guide based on the feedback of caregivers received during the workshops. The setting for my study is urban and rural areas in Ontario. Caregivers participated by video conference using Zoom or by phone. My sample consisted of 6 family caregivers, and they were recruited through the National and Local Alzheimer's Society and Dementia Advocacy Canada through social media, educational presentations, and newsletters as well. Data collection consisted of 4 workshop sessions with caregivers, with 2 to 4 caregivers attending at each workshop. I also conducted interviews following the workshop sessions to get an understanding of what it was like for caregivers to participate in the workshop sessions, and if there's anything else we can improve to support their participation. I also made notes immediately after workshop sessions and interviews. Data analysis was guided by Braun and Clark's approach, and I used experiential thematic analysis to understand the viewpoints of participants through their own realities. In terms of the demographic characteristics, caregivers were quite diverse in age. We also had equal numbers of male and females, and most of the caregivers were caring for a parent. Number of years as a caregiver was 4.9 years. We did have more persons with dementia compared to caregivers in the study, as one caregiver was caring for both parents simultaneously. And the number of years diagnosed with dementia for people living with dementia was on average 4.9 years. Moving on to some of the themes, in terms of adaptation of Namaste care, caregivers suggested integrating Namaste care into daily care routines. So rather than trying to find time to fit it into their day, it was seen as more efficient to fit it into what they're already doing. Namaste care is delivered wherever it is convenient. So caregivers thought that it was best to allow the person living with dementia to choose the room where the Namaste care would happen in that day. Caregivers suggested that persons with dementia be asked to reciprocate an activity. So for example, if they're providing a massage for their family member, ask that family member to also return the massage as well if they're able to increase the sense of helpfulness for that person. They also recommended shorter and less frequent sessions. So rather than use Namaste care on a daily basis for 2 hours at a time, they thought it was more practical to deliver Namaste care 20 to 30 minutes, 2 to 3 times a week. This quote is from a caregiver that shows the importance of integrating Namaste care into things that they're already doing, and this can also help promote the adoption of the approach as well. In terms of Namaste care training, caregivers suggested including information about how persons with dementia may respond to activities. They wanted to know what indicators show that Namaste care was reaching them. They also wanted videos for demonstrating hands-on activities such as massages and a range of motion exercises. Caregivers perceived Zoom as a good alternative to in-person training, especially during the COVID-19 pandemic, where in-person meetings were not allowed. They also thought a shorter training session would be more efficient. So rather doing a full day of training, providing just 1 hour training session, as caregivers reported already doing a lot of these types of Namaste care activities at home. Following the workshop sessions, caregivers expressed that they had an increased awareness of meaningful activities and understood why it's important to implement these for persons living with dementia. They also perceived that they contributed to adapting the program and creating the training guide, and that their ideas and suggestions were very well valued. In terms of the facilitators to meaningfully engage caregivers, caregivers were engaged through by supporting their full participation. So we offered respite for those who required that, and we also scheduled around their workday. Caregivers were also thankful to been provided an opportunity to share and learn from each other so that they could discuss and interact with one another. In terms of the barriers of the workshops, these were related to the Zoom software, which limits interactions and spontaneous questions going back and forth in the group. Caregivers also perceive that some activities will not work because they've already tried them before. And as we'll see in this next quote from a caregiver, some activities were seen as not really relevant to them because they know that the person has progressed towards another stage in the dementia where they wouldn't be able to respond to certain activities anymore. So to conclude, this study will be the first to involve caregivers in adapting Namaste care for a home setting. This study also reveals the need to include caregivers in adapting programs so that we reflect the realities and that the strategies used will optimize their experience and uptake of the intervention following the study completion. Here is a key reference of all of my of what was presented today, and I'm happy to share the full reference for anyone who's interested. Thank you very much for your attention, and I look forward to hearing your questions.